Assalamualaikum and good morning to Madam. My name is Nufara Husna and my other members is Azlin, Dayang Nurul Hidayah and Nur Al-Nisa Ariana. Today, we will discuss the responsibilities of public management hospital and healthcare workers in ensuring workplace safety and health.
Hospitals are high-risk workplaces where healthcare workers are exposed to biological, chemical, physical, and ergonomic hazards every day. Therefore, ensuring workplace safety and health is essential to protect employees, patients, and the quality of healthcare service. Achieving this requires cooperation between hospital management and healthcare workers.
For this slide, I will be explaining the responsibilities of public hospital management. First, hospital management is responsible for establishing safety and health policies. These policies help healthcare workers understand the correct procedures, such as infection control and emergency response, while also ensuring compliance with OSHA 1994. For example, staff should know the proper steps to take if they are exposed to an infectious disease or if a fire emergency occurs. Secondly, hospital management must provide a safe working environment. This includes regularly inspecting hospital facilities, fixing hazards immediately, and making sure emergency exits are always clear and accessible. For example, wet floors should be cleaned immediately to prevent slips and falls, and damaged equipment should be repaired as soon as possible. Thirdly, hospital management must provide enough personal protective equipment or PPE such as gloves, masks, gowns, face shields, and goggles. They should also train healthcare workers on how to use PPE correctly. For example, doctors and nurses wear gloves and face masks when treating patients to reduce the risk of infection. Overall, these responsibilities help protect healthcare workers and ensure they can provide quality care to the patients.
There are three responsibilities of healthcare workers. First, we must follow safety procedures. This means strictly complying with standard operating procedures and practicing proper hand hygiene at all times. It also requires us to dispose of all medical waste safely to prevent the spread of infections. Second, we need to use PPE properly. Personal protective equipment only works if we wear it correctly. Always inspect your gear before using it, and be mindful to prevent cross contaminations during your shift.
Another important responsibility of healthcare workers is to report workplace hazards and incidents. They should report accidents, unsafe conditions, and near misses immediately so that the hospital can take corrective actions. This helps improve workplace safety, prevents similar incidents from happening again, and creates a blame-free reporting culture where staff feel comfortable reporting problems without fear of punishment.
The issues and challenges. First, The pool follow up on hazard identifications and audits. Although hazards are often identified during inspections or audits, many of them are not properly resolved. There is also weak monitoring and follow up, which allows the same hazards to continue. As a result, workplace risks increase and employees remain exposed to danger. Next, poor compliance with safety procedures. Some workers do not use personal protective equipment or PPE correctly. In addition, heavy workload and fatigue can cause workers to ignore safety rules. These situations increase the higher risk of infection and injury or accidents in the workplace. Lastly, weak enforcement of OSH responsibilities. There is a lack of proper training for safety committee members, and safety policies are not fully implemented. Because of this, action taken on reported hazards is often delayed, making the workplace unsafe for employees.
Moving on to the recommendations, there are three ways public hospitals can further improve workplace safety and health. First, hospitals should strengthen OSH training by conducting regular refresher courses, emergency drills, and updating staff on the latest safety practices. For example, fire drills can help healthcare workers know how to respond during an emergency. Secondly, hospitals should improve PPE and safety resources by ensuring there is enough PPE, replacing faulty equipment, and preparing emergency stock. For example, keeping extra glove and face mask in storage can help during a disease outbreak. Last but not least, lastly, hospitals should promote a safety culture by encouraging teamwork, holding regular safety meetings, and allowing workers to report hazards without fear. For example, if a nurse notices a broken wheelchair, they should be able to report it immediately so it can be repaired before causing an accident. Overall, these recommendations can help create a safer working environment for healthcare workers.
In conclusion, workplace safety and health are shared responsibilities between hospital management and healthcare workers. By working together, following safety procedures, and maintaining a strong safety culture, hospitals can create a safer working environment while improving patient care and the overall quality of healthcare services.